Hi everyone, welcome back to the Echo Pod. I'm Quincel from the Echo team, and to my right we have.
Hey everyone, my name is Dr. Freddie Ray. I'm a critical care pharmacist. I work in some few specialty fields, including neurocritical care, trauma, COVID, and medical surgical ICUs. And I also have a YouTube channel, Traumacist RX.
And to my other side we have.
Hi everyone, I'm Grishelle. I am the health programs assistant for Healing Puso, which is Little Manila Rising's mental health equity domain.
Awesome. On today's episode, we'll be talking about what we know so far about long COVID and how it impacts our bodies and mental health.
Yeah, so this is a really great topic that really the whole healthcare and science community is just at like the tip of the iceberg, right? I mean, we don't really know much about long COVID because COVID's only been around for just a few years. But some things that we do know is that when someone does get a COVID infection, it can mess with many of your organs, including, blood pressure control, diabetes management, and even, lung fibrosis and scarring after like a really bad infection. So those are things that we do know are coming out as being evident, but there's a lot more that we have our guest, Grishelle, talking about today.
Yes, and we just want to give a disclaimer that we're not here to induce fear, but to shed light on this condition in hopes to raise awareness about the importance of mental health overall, especially during this time, during this pandemic, and to remind those who are watching this podcast that you're not alone in these experiences and that we hope to empower you to seek medical attention when necessary. And before we start, I just wanted to define what long COVID is. So long COVID is also known as post-COVID, and it's defined as experiencing COVID-19 related symptoms such as fatigue, brain fog, respiratory, cardiac, neurological, or digestive symptoms for longer than 4 weeks after you get COVID. And symptoms can vary from person to person and can affect you physically, emotionally, mentally, and like people who could develop long COVID, it ranges from children to adults and people who are even asymptomatic or have mild symptoms of COVID.
Yeah, I think that's one of the most confusing things is we don't really know the timeline or the range. Some people might report long COVID 2 weeks after their COVID infection, and some people might report long COVID 6 months or even like years after their COVID infection. And it's really hard to justify like where is the borders of like when long COVID starts and ends.
Yeah. It can like manifest in many ways. Too,
Yeah, exactly.
So still a lot of research yet to be done. But to dive deep into like the mental health aspect of it in relation to COVID, we have Grishelle.
Hi everyone. Yeah, so I just wanted to talk a little bit about kind of that integration and how deeply illness is felt, obviously on a physical level, but also psychologically, mentally, emotionally, spiritually. And like Quincel said, there are symptoms that can arise neurologically and can manifest neuropsychiatrically. So that's kind of how Healing Puso was born. It was born during the pandemic, and we just saw a rise in need for accessible spaces for people to talk about how they're feeling and to feel validated in it. And now that we're seeing long COVID kind of emerge and the data start to come in more, we're also seeing how that can exacerbate mental health symptoms, and people who already have, those mental health conditions like depression, anxiety, how that can be a risk factor for long COVID, just like having asthma or cardiovascular disease is also a risk factor in itself. I wanted to also talk about how, in Healing Puso, in our community, sometimes it's just hard for people to express or to have the language to explain how they're feeling. I'm sure that y'all can relate to that too. It's hard to, as it is, to, seek help just because of in AAPI communities and other communities of color that help-seeking behavior is disproportionately lower. But to also add on like the cultural stigma and
Yeah.
the familial shame or whatever it may be that you know, inhibits folks from talking about their mental health and
Yeah.
how that has a toll on them as well, is just that added layer. So
I wanted to say,
Yeah.
yeah, I mean, I feel like, especially in the Filipino community,
Yeah.
there's a lot of stigma or, I guess, like shaming of people who do seek help for being, depressed or having anxiety and all that, and usually, elder family members or anything like that won't make excuses for it, like, oh, maybe you need to
Yeah.
think about this, or maybe you're just not doing this XYZ.
Yeah.
And so my question to you, Chriselle, is like, what exactly do you see when you're helping those patients? Is it stuff like shaming? Is it that sort of thing, or?
Yeah, it's the shame and also, like I said, they just don't have the language to explain, like, oh, everyone gets sad sometimes, but they don't know what that line is in the sand to draw when that is actually symptoms or signs of depression, or that's something that you should be treated for anxiety or something. So it's easy to have folks and talk to folks when we do like grief support groups, or we do one-on-one social emotional support, and it's seeing people come in and talk about and almost like dismiss their own feelings
Interesting.
and say, in the midst of COVID as well, during the pandemic, yeah, obviously I'm sad, obviously I'm feeling XYZ. That's just kind of how everyone's feeling. So it's like they just are conditioned to sweep it under the rug for themselves. Yeah.
So what do you do for people who are expressing their anxiety and depression and mental illness in this way? Like, what do we do to help them find their way out of it?
Yeah, I think, well, for one of the big things that we emphasize, we just offer the social emotional support. Like, we don't diagnose or treat or anything.
Right.
But the first step, of course, is that people even come into this space, so they want to understand how they're feeling. And a lot of the times it ties back to COVID, like the pandemic, and could easily be tied to something like long COVID and people who, how it affects them, their ability to go to work. So then they have financial strain, or they're not able to care for their loved ones, or the grief and the loss. So these things that build up, and then they come into our space and just want to find community. And I think that's a big thing too, is, I'm sure, like, y'all know, we talk about it all the time, like really reframing what collective care and community health looks like. So cultivating those accessible spaces for people, and giving them room to talk it through. And sometimes they realize it themselves as they're just speaking about it, like, oh, this is actually a lot more serious than I thought. And then from there, we have the free referrals to free therapy services
Oh,
and
okay,
connections
that's
with that.
awesome.
Yeah. So that's one of the things too. But yeah, it's just been really great to see even older folks in the community start to embrace that.
What
Yeah.
is the age range?
Intergenerational trauma.
Yeah.
Yeah, a lot of it is focused on youth or adolescents, people in their 20s, but with our groups, we really try to outreach to like the Filipino seniors or other elderly communities too. We have connections with the hospice center, I believe it is too. So just really trying to, because they're the ones who also have higher risk or more risk factors and such, and they're in those care homes or hospice, and
Yeah.
those are the spaces that really need it.
'Cause,
Yeah.
like the pandemic really forced us to be isolated,
Right.
and
Right.
then to experience all these symptoms by yourself is
Yeah.
is
It's tough.
devastating.
It's scary. I mean,
Yeah.
for one, you don't know necessarily. I mean, there's an end date with COVID infection, like 10 to 14 days, but in general, like sometimes you don't. It's not a clear progression of your symptoms, and you're just alone, and no one can really come there and help you because you'll risk of spreading it to others, and that's really that's one of the devastating things about COVID, or like that we know of so far, is that you're doing this all alone.
Yeah, and to have the safe space that Healing Puso provides is awesome.
Yeah.
That's really cool. Yeah. So as far as, I guess I'm just curious, how long, and I know with mental health issues, it's a very long process, but do you have returning members or people that come to your like sessions more and more? Like how long do people usually stay? Or is it more like you see more people doing lifelong sort of thing, or since Healing Pulso has been born?
Yeah, so our community health equity specialist, Crystal, she's the one who facilitates the one-on-one social emotional support, and people have sessions. I want to say 15 or 14 sessions that are every week, and then from there they can extend, or Crystal will decide if that's means for a referral to more help. But people really love to see through all of the sessions, and they do check-ins all the time, and they come to the groups also. And I think what really has people coming back is just like the community aspect of it.
Nice.
Yeah.
Nice. So one of the things that always comes up with long COVID, one of the biggest symptoms that people seem to be reporting more and more is brain fog. So
Yeah.
out of, for those who don't know what brain fog is kind of like a collection of symptoms and sorts of presentation where some people might feel confused randomly. They might not be able to focus at their job. They might not be able to plan ahead or, have a straight thought process, right? Do you have anything to add to that, or that's basically
Yeah,
what
like
you see?
basically like difficulty concentrating and
Right.
doing your day-to-day life
Yeah, exactly.
tasks.
So I wonder, like, how many patients or how many people in the community come to Healing Puso for brain fog, or is that even a thing that is part of your guys' scope?
I don't think it's been named as brain fog. Because again, people may not have the language to even know what that means or what have you. But there is a lot of the mental health aspect of it, right? So I just feel a lower quality of life or a lesser sense of self because I can't go to work, or because it makes me winded to just walk up a flight of stairs, and then they talk about the the aspect of family, and it really does. We talk about long COVID in the workplace and how that can affect financially, but also, yeah, like I said, just affecting someone's sense of self and their own quality of life, how they define that.
Yeah.
So, yeah, I don't think it manifests, or it's named really brain fog, but we see how that can be progressing toward that, or
Yeah.
could be
Yeah.
manifesting
I mean,
similarly.
your brain fog is causing people to be more anxious or more depressed
Yeah.
because they can't remember certain like day-to-day tasks, or
The
oh
domino
shoot, I
effect.
forgot to do this morning. Like, oh my
Right.
gosh, I've been doing this every day for the last 2 weeks. Like, why am I doing? Am I getting old, or is this COVID, or is this a disability I have to live with for the rest of my
Yeah.
life? And now I'm like hopeless.
Yeah, that's the thing too. It's the behavioral abnormalities or the things that people find online. It's all pretty relative, it
Yeah.
seems. Or someone could just be like, I don't know if this is because I'm getting old, like you said, or because this is actually signs of a mood disorder or
Right.
something.
Yeah.
So
That's the difficult thing too, especially for people who aren't in the non-medical field. There are so
Yeah.
many things that, collectively make up our like cognitive ability. Is it labs that are, like anemia where you have low hemoglobin and you just can't focus because you're weak? Is it something to do with like uncontrolled blood pressure or diabetes where you have low blood sugar so you're confused or can't think that way? Is it more of something like a medication you just took? So, something as simple as taking a Benadryl for your allergies or something can make you more sleepy or more sad or like low energy. Or is
Yeah.
it something to do with COVID, where after, your brain and your neurological functions have been decreased substantially for a short period of time because of like the virus infection? Is it causing those connections to kind of be a little slower? Is it that? Or, for the people who have COVID infections or anything like that, who are just like bed rest for multiple days where they're not actively thinking like on a day-to-day basis. When you're at work, you're actively thinking about something, or you're at school. And so those sorts of things where your brain and your muscle function and all that isn't working every day, sometimes you can kind of like, if you don't use it, you lose it sort of thing. And it's about kind of building back, those sorts of muscles. But
Yeah, it's multifactorial.
Exactly.
Like we don't know.
exactly. And that's like this weird thing about long COVID, and brain fog is like one piece of the pie for that. And it's very, comprehensive. So for those listening, if you think you have like brain fog and you're suffering from it or things like that, I think it's always like something to think about. There's a lot of factors in this. You think of like a pizza, right? Or like every slice contributes to possible brain fog. So you kind of want to look into it, try to self-reflect, try to find other resources like Healing Pulso that can really help you identify these sorts of issues and work through it, because I think that there's so many steps to like fixing brain fog, so to speak, that it's not just one thing. So hopefully that encourages some people that there's a lot of things you can think about and hopefully, work through those things.
Yeah. And both of you mentioned long COVID and its relation to the workplace. So I just wanted to shed light that since July 2021, post-COVID symptoms and conditions have been considered a disability under ADA, which is Americans with Disabilities Act. So we just want you to know, like if you're in the workforce, to know your rights and that employers can support employees experiencing these symptoms of long COVID by implementing workplace accommodations. And some accommodations that came to mind would be like allowing rest breaks, flexible work schedules, options for telework, and ergonomic seating and specialized equipment to accommodate these symptoms that you may be experiencing. And through that, like, employers hope that you can retain productivity, reduce absence, and just improve overall morale in the workplace. So, yeah, just to go up to your employer and tell them you have these symptoms, and in hopes that they can come up with like a better work plan for you, because these symptoms do affect your day-to-day life and interfere with performing these daily tasks.
Yeah, exactly. I think, something as simple as, I guess another example would be, so people who might not find like their workplace very ergonomic, I mean, you can talk to your workplace about changing the chairs and stuff like that. Having long COVID is just another part of that thing. Like you can ask your workplace to help accommodate those sorts of things, especially if you've been working there for a long time or this is something that's really debilitating to you and you go to work every day and that sort of thing. Definitely.
Yeah.
I didn't know about the ADA accepting that or including that. So that's really cool.
Yeah, I like how it's kind of reframing long COVID and also the physical and also the mental health aspect of it and how debilitating that it could feel. It's nice to hear that it's in a way embracing that it should be treated just like any other chronic illness, like diabetes, cardiovascular disease, cancer.
Exactly.
Yeah. And I think that's something that is worth noting too, is that we as a society in the workplace, wherever, should also kind of extend the same compassion, support, empathy to people who maybe say that they are experiencing long COVID symptoms, because diagnosis is also kind of hard to come by for that because of the lack of medical literature or data that's out there.
Exactly. You bring up a really good point. So there have been some extensive studies done looking at what biomarkers, what blood tests can be done to show long COVID. And the truth is, none of them show anything, but these patients are suffering from long COVID. And so that's a scary thing, quote unquote, that we just have to think about it, like from your perspective, from like what Chriselle just said, like, you don't know exactly what sort of long COVID someone's going through, but if they stated, like, it's good to acknowledge it because you never know what they're going through. And it presents in so many different ways, not always biologically. We always think of patients who might have depression or anything like that as having like low serotonin or other sorts of, chemicals in their body that signal for happiness. But with long COVID, there haven't been any biomarkers or anything that we can tell as healthcare professionals that you have long COVID, except for when you state it and you kind of like monitor your own symptoms at home and kind of like journal it out. So that's a really good point. I think that as we get past, the pandemic sort of phase and go into more like an endemic situation, and more people continue to have COVID, reinfection, first infection, all that sort of thing, we're going to see so many people are suffering from the same symptoms, and that is long COVID. And, that's just what it is nowadays, and we just have good to acknowledge it. That's really good.
Yeah, the first step is acknowledging it and to not belittle the people who experience these symptoms, because the research is still ongoing and we have yet to know more about it.
Is there anything else you wanted to add, Krishal, about like the mental health aspect with COVID, or what you foresee this for 2023? Is there anything that you've seen, like as far as patterns or anything like that?
Yeah, I do have this. Just wanted to share a little statistic. I don't want to make it too much about these are the numbers, but because of the lack of medical literature that's out there, just because of how new and emerging long COVID is, I think it's important to note what is out there and what has been, I guess, validated or published. So something that I wanted to highlight about the entanglement between physical and mental health and the toll of long COVID. There was something that was published in the Journal of American Medical Association of Psychiatry. There was a study done by Harvard School of Public Health and talks about how psychological distress before COVID-19 infection, which includes depression, anxiety, worry, perceived stress, and loneliness, was associated with a 32 to 46% increased risk of long COVID. Yeah, and it's also states that these types of psychological distress or these mental health conditions were also associated with a 15 to 51% greater risk of daily life impairment due to long COVID.
Well,
Yeah.
that's interesting. So to kind of like bring it full circle, we talk a lot on especially with Echo Podcast and previous IG lives about the risk factors that people need to watch out for. obesity, diabetes, hypertension,
Right.
all that sort of stuff are risk factors for severe COVID. But no one has ever mentioned that I've ever heard of, the psychiatric risk factors.
Right.
And so like you mentioned, patients who had like that sort of distress and stress and all that stuff before COVID had like a worse outcomes basically, right?
Yeah.
And that's something we should be talking about more.
Yeah.
So your risk factors include not only hypertension, diabetes, obesity, but also like if you felt distressed, was it stress, loneliness, anxiety, depression before like COVID infection. Like those are some things we really need to highlight. I'm so glad that you found this article.
They're true risk factors that
Yeah,
we
these
don't
are-
talk about.
Right.
Exactly.
It's minimized and taboo to talk about that, especially in the AAPI community. But
Right.
we want to
Wow.
give people a safe space to talk about it.
Yeah, no, this is mind blowing, honestly.
Yeah.
I mean, like, so we plan on our talks like here and there, but we usually like kind of wing it with these articles. And this is the first time I heard about this, and hopefully we can talk a little bit more about this mental health risk factor aspect of COVID, because it's something that we don't usually see in the hospital
Yeah.
until patients like are about to get discharged, or they, it's expressed to the nurses or bedside people more frequently and things like that. So, wow.
Yeah.
Yeah, we need to recognize that there is that psychological
Yeah.
aspect of COVID, long COVID, on top of like the physical risk factors as well. And they both intertwine and both affect you greatly. So
Yeah, exactly.
Yeah, and it's all part of this big umbrella of raising public health awareness, the physical health and the mental health. So I think that was something that stood out to me too. So I really wanted to share.
Thank you for sharing.
yeah, thank
Yeah.
you.
It's really mind blowing. Any last words, Quincel, or anything else you wanted to hit for today's talk?
No, that was a lot to unpack, and for us to learn more about long COVID as the pandemic becomes an endemic,
Yes.
we have yet to learn more.
Exactly. Yeah. So again, like if you're listening all the way to the end, thanks for listening. So long COVID is still being researched out there, but today really unraveled a lot of things that we talked that are in the news that are currently being researched, like brain fog, mental health being a predisposed risk factor for COVID. So stay tuned for more discussions on these as we progress through 2023 and beyond.
Yes. Thank you for having us today, and or for Grishel for joining us,
Thanks, Sil,
and
for
for
having
Dr.
me.
Freddie for
Thank you.
your time. Thank you.
Any last plugs or anything?
Yeah, your Instagram.
Yes. So if anyone resonated with what I was talking about, or also just wanted to join in and find community, we are always about cultivating protective community care and collective healing. And we also explore things if people are interested in exploring what holistic healing looks like, traditional medicine, especially through a culturally rooted healing lens. We offer a lot of free sessions, free one-on-one social emotional support, as I mentioned before, referrals to free therapy services or other treatments. And so you can find us on Facebook and Instagram at Healing Puso, or email us at healingpuso@littlemanila.org, and we'll be happy to connect you, hear you about your needs, and really try to help navigate the resources and services that are out there.
Nice.
Awesome. Do you
Awesome.
want to?
Yeah, so for me, you can find me anywhere on TikTok, IG, and YouTube at TraumasistRx, and I focus on improving health literacy and making health easier to understand.
Awesome. Have a great day, everyone.
All right, thanks for listening.
Tune
Take
in next
care.
time.